Good Wednesday evening, ladies and gentlemen, and thank you for joining us for this COVID-19 update. I'd like to acknowledge the Minister of Health, Wellness and New Health Investment, Honorable Dr. Irvin McIntyre, the Minister for Tourism, International Transport and Maritime Initiatives, Honorable Denise Charles, Permanent Secretary in the Ministry of Health, Wellness and New Health Investment, Letitia Lestrade-Wyke, Permanent Secretary in the Ministry of Tourism, International Transport and Maritime Initiatives, Lisa Valmont. Also with us, we have the Coordinator of Border Reopening Program, that's Dr. Laura Esprit, the National Epidemiologist, Dr. Shalauddin Ahmeh, and the Quality Control Manager at the Dominica China Friendship Hospital, Tamika Hogan. This evening, we'll be focusing on several aspects as we continue in our fight against COVID-19. We'll begin, of course, with our statistical information as presented by the National Epidemiologist.
Minister for Health, Wellness and New Health Investment, Honorable Dr. Irvin McIntyre. Minister for Tourism, International Transport and Maritime Initiative, Honorable Denise Charles. Permanent Secretary for Health, Wellness and New Health Investment, Mrs. Letitia Lestrade-Wyke. Coordinator of Border Reopening Program, Dr. Laura Esprit. Quality Control Manager at the Dominica China Friendship Hospital, Ms. Tamika Hogan. Our Communication Officer, Ms. Sheena Harry, media and listeners. Good evening all. As of today, our active COVID cases are 13. In total, 72 cases have successfully recovered, and there are no deaths to date. Over the past week, we have had 5 new cases of COVID-19. 3 of these cases were identified through rapid testing at the airport, and they were IgM positive initially and then confirmed through PCR testing. 1 case was detected through the routine day 5 testing at the quarantine facility. And the 5th case was detected via our pre-travel screening. 3 of them are between the ages of 35 to 40 years, and 2 others are over 70 years. 2 of these cases are foreign nationals. They are asymptomatic. A total of 20 contacts were identified for 1 of the index cases. Further to our contact tracing, we plan to conduct screening for target populations. They are our elderly folks who are in nursing care facilities and selected areas that are considered hot zones. Now for a brief reminder on the clinical features of COVID-19. At the beginning of COVID infection, clinical presentation mimics that of flu and may also present with a low-grade fever and coughing. However, in severe form of COVID, one may present with respiratory distress and may require ventilator. If anyone is experiencing a flu-like illness, we are asking you to contact your nearest health care facility for medical advice. It is important to note that a person with COVID may take 2 to 14 days to develop symptoms and could remain contagious for up to 10 days. Remember, the precautionary measures for COVID and flu are the same. Frequent hand washing or the use of an alcohol-based hand sanitizer, maintaining proper respiratory etiquette, maintaining a distance of 6 feet, wear a face mask while you are in public, avoid handshaking and touching any surfaces outside of home, and avoid public gathering as much as possible. So with this, I thank you and have a good evening.
Thank you so much to the national epidemiologist, Dr. Shalauddin Ahmeh. And again, 5 new cases since our last COVID-19 update. Currently, 13 cases are active. Next this evening, we welcome, for the first time at our press briefing, the Quality Control Manager at the Dominica China Friendship Hospital, Tamika Hogan.
Good evening. It is certainly a pleasure to be here with you this evening. I would like to acknowledge the presence of the Minister of Health, Wellness and New Health Investment, Honorable Dr. Irving McIntyre, Minister for Tourism, International Transport and Maritime Initiatives, Honorable Dennis Charles, Permanent Secretary in the Ministry of Health, Wellness and New Health Investment, Letitia Lestrade-Wyke, Permanent Secretary, Ministry of Tourism, International Transport and Maritime Initiatives, Lisa Valmont. The Coordinator of Border Reopening Program, Dr. Laura Esprit. The National Epidemiologist, Dr. Shalauddin Ahmeh. I extend a warm welcome to all. When we speak about patient safety, we think about doing everything possible to avoid harming our patients who are entrusted to us. Patient safety advocacy is a fundamental aspect of our work at the Quality Department. We love our patients and we are primarily concerned about our patients' safety and their well-being. I would like to use this opportunity to speak to one, our patient safety initiatives for COVID-19, 2, our individual roles and responsibilities in COVID-19 risk reduction at the Dominica China Friendship Hospital. Patient safety is the responsibility of everyone, especially those of us working at the hospital. We each must ensure that we understand our roles and play our parts to minimize the risk of incidents that impede patient safety. Although we have made significant strides in infection prevention and control and quality management, we still have miles to go. Are we perfect? No. Can we do better? Yes, most certainly. So we have to continually aim higher and keep improving. It takes more than the effort of one department to bring about sustainable change for improvement. You will agree that a change in culture and dedicated teamwork equals success. We cannot do this alone. Most definitely, we need your help. Protecting our dear patients and service users during this pandemic is our number one priority. So tonight, I will outline our priorities for patient safety amid this COVID-19 pandemic. First of all, let us speak to the enforcement of the hospital's no visiting policy. While we acknowledge that the patient has a right to receive visitors, we cannot compromise the safety of our patients by allowing all and sundry access to our patients. Therefore, in an effort to protect our patients, only the patient's next of kin will be allowed brief, limited visits on the wards. Other close relatives are at liberty to do drop-offs at the entrance of the wards and at the accident and emergency department. However, in the case where a patient is seriously ill and has taken a turn for the worse, other close relatives may be allowed to visit at the discretion of the specialist medical officer, the ward sister, or the nurse in charge. The benefits of our no visiting policy are twofold. One, our patient risk for contracting COVID-19 infection from the public while they are admitted is decreased significantly. And 2, the relatives are protected from harmful pathogens or germs often found in hospital settings. Those germs found in hospital settings can only be killed with hospital-grade disinfectants. These germs can easily be transferred if standard or transmission-based precautions are not observed. These germs can make you sick. So please, stay away as much as possible for your own benefit. We are appealing to the next of kin and close relatives. We are asking them to please use alternatives for direct communication. When I say alternatives for direct communication, I mean use your phone. You can call. If you come there twice already for the day, you can call your granny or call your mother or call your father, Daddy, how are you doing? You don't have to come back to the hospital. Another thing that we are appealing to the next of kin and close relatives to do, please dress decently, dress discreetly. If you are allowed to enter the ward, we do not want to see persons coming with halter tops or very short pants or skirts. You will not be allowed to enter the ward. Okay? And another thing we want to appeal to you to do is to wait, please, for the directive of the specialist medical officer or the ward sister or the nurse in charge to enter the ward, since frequent interruptions may delay the management of the patient. So if a nurse is going to give the patient medication and there are frequent knocks on the door, she has to come to speak to the person at the door, and it delays the management of the patient. So we will just continue with the no visiting policy. We're also asking persons to please, there's absolutely no visiting of patients who are admitted to the COVID-19 quarantine or the isolation unit for obvious reasons. So what you can do, although you cannot visit these patients, what you can do, you can call 266-2126 to make arrangements for dropping of items at the quarantine unit. I'll just repeat. You can call 266-2126 to make arrangements for dropping of items at the quarantine unit. And if your loved one is at the COVID-19 isolation unit, you can call 611-3969 to make arrangements for dropping of items. So let me just repeat. If your loved one is at the COVID-19 isolation unit, you can call 611-3969 to make arrangements for dropping of items. Preferably, we would accept items in disposable containers. Items such as bed linen are provided by the hospital. So don't bring sheets and pillowcases and all of those things. The hospital will provide those things. If you drop off items that are non-disposable, they will be disinfected and returned only upon the discharge of the patient. Okay? I would like to thank you, our dear patients and their relatives, for making these sacrifices regarding your right to visit. Your efforts are very much appreciated. I would like to also highlight the role of the hospital management team in relation to protecting our patients. From the onset of COVID-19, even before the first case was identified, terms of reference were developed for the Dominica China Friendship Hospital COVID-19 team. This team consists of the hospital medical director, the hospital services coordinator, the matron, the infection prevention and control officer, the chief pharmacist, the central medical stores supplies manager, the facilities manager, the head of internal medicine, the head of the A&E department, and the quality manager. And we meet weekly to identify and resolve gaps in our service delivery and management of confirmed and suspect COVID-19 cases. Under the leadership of Dr. Ruby Blah, the hospital medical director, we were successful in drafting a COVID-19 policy. I wish to highlight that Nurse Joanna Loa Blaise, Infection Prevention and Control Officer, has been very instrumental in drafting, implementing, and monitoring indicators written in the hospital COVID-19 policy. Another noteworthy activity of the hospital's COVID-19 team is the development of standard operating procedures for the management of suspect COVID-19 patients in each clinical area. So in the case where someone is admitted to Alford Ward, and while he is admitted, a few days after admission, let's say he was admitted for a broken leg, and a few days after admission, he develops flu-like symptoms. We know exactly what to do to isolate that patient. We know who to call. We know how to protect the other patients on the ward. All the procedures are written in flowchart format and are accessible to staff. So as we speak about our role as individuals in protection of ourselves and others at the hospital and elsewhere, let us listen, let us meditate, and let us apply the information that we're going to discuss right now concerning our role as our individuals. We just spoke about the role of the hospital management team, so now we're going to speak about our vital role as an individual. So what we want to do, we would want to acknowledge that prevention is better than cure, and this statement cannot be overstated. And so we must individually demonstrate our commitment to work together and to take responsibility for our health and that of others. We have to be our brother's keeper. And only then we can become a powerful movement for progressive change. So we have a few practical things that we can do, and you will say, oh, Mrs. Hogan, I've heard that a million times. But these little things count. And if we practice these things frequently, they will become part of us and part of our daily routine. First on the list, wear our mask and wear it well. Our mask should cover our nose and mouth fully and snugly, especially when we are entering the hospital premises, or when we are attending outpatient clinics, or when we are accessing care at the A&E department, or even when we are waiting for lab or radiology services. We often see persons with masks under their chins or in their hands, or they tell you that the masks are in their pocket. But when we do those things and we do not wear our masks properly, we fail to show neighborly love, and we fail to protect each other, and we fail to protect our patients. Another thing, when we come to the hospital, we want to avoid touching surfaces unnecessarily and practice frequent hand hygiene. We want to pay attention to the hand hygiene posters that are located on the walls and in other strategic areas. We want to keep a bottle of alcohol and or hand sanitizer on our person. We want to practice cough and respiratory etiquette, especially when in close proximity to others. So you cough, you cover your mouth with tissue, you dispose of the tissue immediately in a covered bin, and then you perform hand hygiene. We also want to practice, remember to practice social distancing in waiting areas. We know better. We don't want to deliberately disregard the seating arrangement that promotes social distancing. We want to comply with screening protocols at the hospital's entrance, answer questions related to travel history and flu-like symptoms. We want to be honest when answering those questions. When the healthcare provider asks us a question concerning the flu, if we have symptoms, we know we have symptoms, but yet we say, no, we're okay, and so on. But we want to be honest when answering questions concerning if we have flu-like symptoms. We want to observe and apply all safety precautions for parking, since the hospital is in an active construction site. Please, please do not encourage patients to leave the ward and come outside to meet with you. When you do this, you are putting the patients at risk. We want to call the hotline first if we have any flu-like symptoms. Do not come to the hospital before you call the hotline. Remember, our intention is to provide and promote patient safety. The hotline numbers are 448-2151, 448-2153, 448-2156, 611-4325, 1-800-219. Please do not get angry with our staff or bully the staff or use foul language whenever these policies or protocols are brought to your attention. We can imagine how difficult it must be for you with these visiting restrictions. But as staff, we need to do what we have to do for our patients. And please help us to fulfill our obligations to our patients. Everyone has their role to play, and pregnant women are no exception. It's not business as usual at the maternity unit. So pregnant women at approximately 20 weeks gestation, you are obligated to call the maternity unit at 225-5902, 225-5902 to alert the staff of your intent to access care on the ward. In case of an emergency where you or your OBGYN or your doctor are unable to establish contact with the maternity unit, staff, wear a surgical mask, knock the entrance door, and wait for instructions for entry into the maternity unit. Let me take the opportunity to thank all our healthcare workers for their hard work, their sacrifices, and their dedication in the fight against COVID-19. Some have had to spend months away from their families. Many have deferred their vacation leave. Thank you. If you would permit me to give my experience this morning, in the corridor I met one of our doctors and I said, "Doctor, how are you this morning?" And she said to me, "Mrs. Hogan, I'm tired. My plat pied hurted me, but I'm happy to be here." So when I hear those comments, I thrive on these comments because I know that our healthcare providers, I know how they feel about our patients. So in conclusion, we spoke about knowing, understanding, and applying our roles for COVID-19 risk reduction. We mentioned some practical behaviors that all of us can employ in the interest of patient safety. So please, supli, por favor, let us remember to play our parts to keep COVID-19 at bay, thereby improving and promoting patient safety. I thank you very much for your time and your attention.
And we thank Mrs. Tamika Hogan, who is the Quality Control Manager at the Dominica China Friendship Hospital. Of course, there are many inconveniences, as she mentioned, that we have to adapt to in these new circumstances, many lifestyle adjustments that we have to make. And nobody doubts how anxious family members can get when somebody's admitted or tested positive for COVID-19. However, we can all appreciate that patient safety is paramount. And we want to thank Mrs. Hogan and the staff at the Dominica China Friendship Hospital for their efforts thus far. Next up this evening, we welcome to the podium Dr. Laura Esprit, who is the coordinator of the Border Reopening Program.
To the Minister of Health, Wellness and New Health Investment, the Honorable Dr. Irvin McIntyre. To the Minister for Tourism, International Transport and Maritime Initiative, the Honorable Dennis Charles. The Permanent Secretary in the Ministry of Health, Mrs. Letitia Wyke. The Permanent Secretary in the Ministry of Tourism, International Transport and Maritime Initiatives, Ms. Lisa Valmont. Our National Epidemiologist, Dr. Ahmeh, and the Quality Control Manager at the Dominica China Friendship Hospital, Mrs. Tamika Hogan. Good evening to you, the media and the listening public. Question. Most times when you think of reopening of borders, what words besides COVID come to mind? My first 5 picks would be airports, protocols, quarantine, PCR, and stress. Am I correct? But is this really all there is to it? I am sure that most have not considered the hard work that goes into the final product that you read online in preparation for your trip, or the processes in place when you actually land in Dominica. So this evening, I beg your indulgence to walk you through some of the behind-the-scenes activities so that you can better appreciate the tireless collective efforts that are placed on your health and safety. I had the privilege of conducting an interview with 3 siblings who arrived in Dominica last month, and I thought it relevant to share their grievances with you as they recounted the worst parts of their travels. Interestingly, their views varied. So, Mr. John Doe was very upset about not having his notification in a timely manner, verbalizing threats of what would have happened if he had lost his flight. Jonathan Doe, on the other hand, he went erratic about his displeasure with what he deemed to be thoughtless protocols. And Jane Doe was simply not amused having to sit for hours in a hot shed awaiting the shuttle. John Doe, quoted earlier, essentially had concerns with the pre-arrival process. He said, "I didn't receive an email with the notification before leaving the US, and it created a lot of unnecessary anxiety for the family." Investigations into what happened proved that the siblings only completed the health questionnaire whilst in the in-transit lounge at MIA, with the expectation that within minutes they would have gotten a response. Contrary to their views, the protocols dictate that same should be submitted at least 24 hours prior to arrival. But guess what? We always try to accommodate you. To define the process, just for you to know, it took weeks to review the available information, regionally and internationally, to come up with drafts of what an appropriate and passenger-friendly screening document would look like. We had to ensure that all stakeholders in health and across other ministries, including tourism, was satisfied with the content of the material. An IT committee had to be set up to ensure that the electronic platform was created with ease of use. This took countless meetings, including the submission of a clean document to the ministerial subcommittee and onwards for cabinet consideration. Finally, with an approved document in hand, the implementation phase begins with staff knowing their roles and responsibilities. Now, having the implementation now figured out, reports now come in with the concerns of service access. This requires groups of people in their respective fields to dedicate time, even throughout the night, to ensure that you have access before your flight next morning and to avoid you from being stranded. But interestingly, in the case of John, he later apologized when he realized that despite his late submission, his notification email was actually in his spam mail all along. So the traveling public is therefore encouraged, please review your spam and junk mail prior to registering your concerns. Okay. Jonathan, the second brother, was adamant that the meaningless protocols needed to be adjusted to suit persons coming from the US, because it's from the US. Well, Mr. Doe, in the real world, we wish there was a one-size-fits-all protocol, but that's not the case. However, our record shows that our national protocols do work, sparing us from community transmission of COVID thus far. The process of drafting protocols starts with a small core group, capturing the ideas in a written format. Regional and international guidelines are consulted, especially that of the CDC, WHO, PAHO, and CAFA organizations. Sometimes this may entail making calls to our global counterparts to clarify, discuss, and exchange documents, all in an effort to provide the best product for Dominica. Draft documents are then discussed at the ministerial level, with subsequent deliberations at the working group committee, the technical committee, the ministerial subcommittee, and of course, cabinet. Concerns at any level means that the draft document will be relayed downwards with a view to address specific points. This sometimes takes weeks, giving everyone the opportunity to critique and sometimes pilot featured or new aspects. Various meetings are held, sometimes 3 times a week, with average meeting time being 5 hours. So kids, it's like going to school on time and returning home for lunch, and we are still talking about the subject matter, just for you to get it. Protocol implementation requires that all heads communicate with their relevant staff on all approved or updated protocols. This may involve multiple site visits with reenactment of various scenarios as part of simulation exercises, all in an effort to ensure that every category of staff is prepared for the unexpected. The refining process that follows means that with every complaint received, there is a 3-phased approach: reporting, deliberating, addressing, RDA. Reporting, this actually means that complaints, whether formal or informal, or received whilst monitoring social media, are documented and compiled on a weekly basis. Deliberation allows for the relevant ministry or ministries to investigate and discuss matters with a view to addressing them with a sense of urgency. Again, concerns, recommendations, and decisions are channeled through the various committees for remedial action and to seize every opportunity to improve the experience for you, the traveler. To date, there are almost 13 approved and tested protocols in relation to the Borders Reopening Program, which encapsulates the Douglas Charles Airport, Longhouse Port, sea vessels specific to tugs and barges, as well as the Safe in Nature Managed Experience at COVID-certified properties. So quoting Jonathan on his statement of thoughtless protocols, I leave the response to you, the audience, as to whether he's correct or not. Now let's take a look at Jane's complaint of heat and long waiting time. Initially, if you recall, there were tents at the entrance of the arrival terminal, remember? We found ways to fit in everything essential, when likely before COVID, DASPA would have thought this to be impossible. Specific protocols to the airport, in addition to countless meetings and site visits, were held. Due consideration placed importance on infection prevention measures to avoid possible cross-contamination. We listened when you said that you were seated under the tent, but in the sun, having to wait for the bus, remember? Sometimes with heavy rains, especially in the midst of an active hurricane season. It took all relevant stakeholders, including government ministers, the cabinet secretariat, and the permanent secretaries, to walk the grounds of the airport to identify a more suitable and comfortable venue for you, the passenger. As a matter of fact, before we left that day, a decision was made to have the identified building retrofitted into an inviting and comfortable screening facility. Consideration was given to spacing, flow of passengers, airflow, lighting, privacy, and security, among other factors. This week, plans are in motion to have relevant health and tourism information on the television screens that are already installed, in addition to, of course, stabilizing the Wi-Fi access. Further to the aesthetics, regular sanitization occurs during flights, and logistical support is provided in the form of information officers to assist you throughout the process. So to Jane, besides the huge fans that are installed and the lattice boards used to promote ventilation, we welcome you to the tropics. And Jane, in reference to your 1.5-hour wait at the airport, it's important to note that the protocol dictates adequate spacing that must be maintained during transportation, with an average of 9 to 10 persons and their luggage being accommodated at a time. Unfortunately, you were the 11th passenger, thus having to wait for the next scheduled free shuttle. However, the option existed, which you knew of, either to wait or to hire a certified taxi to the quarantine facility, and you chose not to. So, are Jane's complaints legit? Again, I leave this to you, the public, so as to determine the answer. So to our potential travelers, kindly acquaint yourself with the available transportation options as well as schedules. On this note, I am happy to report that thus far, since the official reopening of our borders, over 3,500 persons were welcomed at the Douglas Charles Airport. To culminate this evening, I wish to remind all Dominicans to adhere to the social and prevention measures, which I am sure all can recite backwards. But friends, there is a difference between knowing and doing. We recite that famous scripture, that faith without works is dead. So does claiming to be blessed with natural immunity automatically protect you from contracting COVID? No. Works or actions will ensure that we take every precaution to keep our families and our neighbors safe. So for example, action means keeping the mask on over your mouth and up to the bridge of your nose, not under your chin, around your ear like an earring, certainly not in your bra or inside your pocket, but on both nose and the mouth, especially when in proximity to other persons. It is advisable that you try various sizes of mask and talk with it on to ensure that it remains properly fitted. Secondly, which is more important, safety and health of our family and friends, or enjoying social gatherings and celebrations just to have a good time? Again, action speaks louder than words, just as having knowledge is useless in the absence of timely application. On this note, I wish to conclude with thanks to all the persons who work behind the scenes. Those include persons who spend tireless hours through the nights and the weekends, drafting, reviewing, critiquing, and refining, only to improve your travel experience. Those who listen to your concerns, even in the absence of questions, just to allow you to vent. Those at the ports and quarantine who take verbal abuse without retaliating. Those who transport you to safety at the COVID-certified properties, irrespective of the long drives. Those who may be sick and tired, yet remain alert to revising your submissions and providing timely support. Those who consider the soundness and practicality of protocols from a legal and holistic standpoint, they diffuse potentially explosive mishaps, all in the interest of your safety and comfort. To all the providers of essential services who over 10 months have not been distracted and dealt with the pandemic head-on alongside all the other duties and responsibilities. And last but not least, the sacrificial spouses of these providers who have been relentless, exercising patience and support when the job takes priority. To express your appreciation to these ones, we implore you to show it by adhering to the social and prevention measures and being even more cooperative by helping us whilst we help you to remain safe. Thank you very much.
And our thanks to the coordinator of the Border Reopening Program, Dr. Laura Esprit. And as she said, your concerns are not being overlooked. One of the words that we heard right at the beginning of this pandemic is fluid. It continues to be a fluid situation. We continue to learn, and we all continue to grow together to improve conditions as best as we can. Thank you again, Dr. Laura Esprit. And finally, this evening, we welcome to the podium the Minister for Tourism, International Transport, and Maritime Initiatives, Honorable Denise Charles.
Permanent Secretary in the Ministry of Tourism, Ms. Lisa Valmont, Dr. Ahmed, Ms. Hogan, Dr. Esprit, the media listening public. Good evening. Fellow Dominicans and patrons, I wish to inform you that after much deliberations and consultation, the government of the Commonwealth of Dominica has taken the responsible decision to cancel our annual carnival, Mass Dominic 2021. We are aware of the historical, cultural, social, and economic relevance of our carnival season. However, during this COVID-19 era, health and safety continue to be our priorities. Therefore, following discussions with key stakeholders, it was concluded that holding events of mass gatherings may pose a serious threat to our health, and this is a risk that we are not willing to take. As we have been doing in the tourism sector, we'll continue to use this period to strategize on enhancing on other events and festivals for 2021, 2022, and beyond. While we are cautiously optimistic about the state of vaccine development, production, and distribution, we are still assessing COVID-19 impact in 2021. It is hoped that we will continue to take all necessary steps to contain the spread of this deadly virus. Please follow the protocols. Wear your mask, wash and sanitize your hands, practice respiratory etiquette, and keep your distance. Stay safe, everyone.
Thank you so much to the Honorable Minister for Tourism, International Transport, and Maritime Initiatives, Honorable Denise Charles. Ladies and gentlemen, you heard that announcement. Carnival 2021 has been cancelled. But that just further concretes the fact that COVID-19's impact is so far-reaching. But we cannot take the risk, as the Honorable Minister said. Is it worth it to us to risk the lives of so many people for a mass gathering? And we appreciate the efforts of the Minister of Tourism, all the other stakeholders who have had to take this difficult decision. I'm sure this did not come easy. This was not done lightly. But with all the considerations taken, this is the best decision for Dominica. Ladies and gentlemen, we thank you for your attention. We thank you to all the presenters this evening for your time. We thank you to our media partners for making this possible. And we wish you a great evening. Thank you. And we are clear.